Get started. Love music, love life. Nothing beats the sound of jazz on a good Saturday morning. And of course, when it concerns the jazz, the soul, the R&B, the funk, Smooth 98.1 got you covered. Right now, you're listening to Soul Food, and Soul Food is the show that talks about health, wellness, fitness, nutrition, and everything really that can keep you alive or at least increase the years that you have on planet Earth. We do that every Saturday morning from 8 a.m. till 8:30, and we have our special guests, consultants, experts, professionals in this field, in whatever field we are discussing a thing. Now, for the month of September, we have been talking a lot about getting old, growing older, and every other care that comes with growing older and the attention. So this morning, we're wrapping it up by talking about geriatric care in Nigeria. If you're hearing that word for the first time, do not worry, you're in safe hands because my guest will explain what it involves to you. And if you have any question later on, you can ask on our WhatsApp line. But before then, we're streaming live on YouTube, youtube.com/smooth91FM Lagos. Again, youtube.com/smooth91FM Lagos. As my guest this morning is a UK certified consultant geriatrician and also the chief executive officer and the founder of JBS Medicare Services, which is a specialist elderly medicine, nursing, and therapy service. And currently, it is the only geriatrician-led private healthcare service in Nigeria. My guest also is the editor of the Healthier Aging Digest and the convener of the Healthier Aging Conference, which started in October 2019 and now holds annually. Now, aside her love, which is intense through her profile for aging, she actually is an avid traveler, which again, I think it was just interesting that she has Ajala in her name because I know I grew up hearing story of Ajala travel, and she is Dr. Olutoyin Akande-Ajala. Now, if you're wondering what the connection is, she has traveled to at least 58 countries, including Antarctica. That is a record. So please welcome Dr. Olutoyin Akande-Ajala. Good morning.
Good morning. Good morning. I need to correct you there. I've actually been to 70 countries. So
you said?
I said 70 countries now. 70.
Oh,
yes.
How do you do it? 70 countries.
Yes, 70 countries. Yes. I'm just, I think it's about being intentional about things. It's the same with aging. We have to be intentional about everything we do so that we can get things done, Same with aging. If you want to age right, you have to be intentional about doing things right so you age well, So that's how I do my traveling. I do it with intention, so that's it. It's part of my age. It's part of my age well strategy.
Okay. Okay, we'll get to that definitely because I cannot wait to hear all the story, especially how you even got on this path, which is something that is not common in Nigeria. But like I mentioned earlier, so that somebody has a better idea of what geriatric care and maybe who a geriatrician is, let's start by breaking it into the basics. What geriatric care involves?
So geriatric, that term actually involves elderly. So if someone says to you, you look geriatric, that is not necessarily a compliment because that means that you look old. So geriatric means old, it means elderly. A geriatrician is a physician for elderly people, a physician for old people, as in we have specialist training. A very long specialist training program for geriatric medicine. We don't have it in Nigeria. I trained in the UK, and lots of people have trained elsewhere, in the US, Australia, Canada. But that is what geriatrics is about. So geriatric medicine is medicine for older people or medicine for the elderly. That's what geriatric medicine is about. Geriatric care now falls, under two arms. There's geriatric healthcare. So someone like me, I'm a doctor for geriatric people. I'm a doctor for the elderly. I am not a family doctor. I am a specialist consultant physician. So what's it, people say, oh, physician, family medicine, we'll talk about that as well, but there's a distinct difference that I'll talk about shortly. But geriatric care, so when you talk about geriatric care, it's healthcare and social care. There are two arms to geriatric care. There's the healthcare when they're sick, when they've got specialist conditions that only elderly people have, when they have those conundrums that only elderly people have. And then there's a social care aspect as well, which is the part where they actually need looking after. They need looking after because they have lost their independence. They've lost the ability to look after themselves in social settings at home. So that's the two arms of geriatric care. There's the health aspect, which, me as a physician for elderly people covers, and the social aspect, which is also covered by, it should be covered by specialists, specialist nurses, specialist social workers, people who know what elderly people need, who've had training there and can provide that care. So my JBS Medicare Services, we're a one-stop shop. We have everything. So there's the medical side, there's the social side. We try to put it all together under one umbrella so that we can provide those services for everybody who is elderly, in Nigeria. So I hope that explains. Yeah, hope that explains.
Yes. Thank you for the clarity. I'm curious about your journey because you mentioned earlier when you were speaking how we don't have it here in Nigeria. You graduated, if I'm correct, from University of Ibadan, and that's you right. Had your training in UCH, that's University College Hospital, all the way in 1991. And you proceeded to have some other trainings as well as moving over to the United Kingdom to specialize in this. Now, how did you get on that path? Because do we have people who teach that here? I don't think we do.
So in 1991, when I graduated from medical school, there was no such thing as geriatric medicine here. The first time I came across geriatric medicine was when I got to the UK. So I got to the UK in 1992 and, looking through jobs, I came across geriatric medicine. I thought it was interesting. And I specifically actually went for a job in geriatric medicine in Wales, in the UK. Don't ask me why, but that was what I wanted to go. I wanted to go to Wales. I'd heard that Welsh people were very nice. I thought that would be a nice way to start, as into breakthrough, just into a nice community and go and do geriatric medicine. When I got there, so my first encounter with geriatric medicine, we did not have it at all in Nigeria, no geriatricians whatsoever. It wasn't a specialty. Even in the UK, geriatric medicine it's a relatively new specialty. It started in 1960. The mothers of geriatric medicine, Marjorie Warren, etc., they started geriatric medicine in 1960. Because of the needs of the elderly population. They just found that other physicians could not really get their head around most of the things that were troubling elderly people. Sick elderly people were being thrown into or pushed into these hospitals outside because nobody knew what to do with them. Nobody knew what to do with them. So it became clear that they needed specialists, people who would be trained to study the problems that elderly people have, the medical issues, the healthcare issues, the social issues, and to help to manage these problems. And that's how elderly medicine started in the UK in 1960. So relatively new compared to the other specialties. So we have other physicians who are cardiologists, endocrinologists, chest physicians, rheumatologists. Geriatric medicine is one of the babies of where physicians are concerned. We're a baby specialty. So can't blame Nigeria for just catching on. And my first job was in geriatric medicine, and I absolutely loved it. I loved it because I knew I wanted to be a physician. I didn't want to be a surgeon. I could not stand wearing masks. Well, COVID-19 solved that problem. I could not stand, gowning up and I didn't particularly like the sight of blood and all of that. So I knew I wanted to be a physician, not a surgeon.
Mm.
But in being a physician, I'd have had to choose an organ. So maybe the heart or the kidneys or I wasn't sure what I wanted to do. Geriatric medicine solved all of that for me, because we have to have training in all of that whilst we are, training to look specifically after elderly people's problems, health problems.
Mm.
My first consultant, John Morris, he's the J in JBS. He told me, he said, Toyin, you're a natural born geriatrician. I thought, what? It turns out that was true. I am a natural born geriatrician, clearly so, because I absolutely love my specialty. And that was how I started down that line. Geriatric patients are kind of like pediatric patients. When a child is sick, they're sick. They look sick. When a geriatric person is sick, if you've got the experience, once you see them, they're sick. And, the skill is in being able to decipher what the sick is and how to manage it properly. That's the skill that comes with geriatric medicine. It comes with training, it comes with experience. So yes, that's my journey down into geriatric medicine. And I hope that answers that question as well.
Yes, it does. Thank you. Now, you have mentioned that even in other parts of the world, including United Kingdom, it's relatively a new practice. Here in Nigeria, do we now have it included in the courses that you have in medical school?
The courses that are included in medical school, no. But in terms of postgraduate training, there have been some changes. So in 2000, and I can't remember, was it 2014? I wrote to the then Minister of Health of Nigeria, to introduce this concept of geriatric medicine. He says he had, so for him, like with many people, geriatric medicine was new. What is this? What's she talking about? And he did some delving and got a team together, and they went outside. They went to, the University of Birmingham. They had some kind of collaboration with the geriatric department there, and they were able to bring some things back to Nigeria. So as far back as 2011, people had started. I came to Nigeria in 2007 with this grand, lofty idea about geriatric medicine, setting up this geriatric center. I hit a brick wall. I went to everybody I knew. I come from an academic background, so I thought, okay, let me at least go to those centers where, so UCH Ibadan. I went and spoke to my godfathers there. I was like, oh, geriatric medicine. Nobody was, well, I thought nobody was interested. But what happened was actually it set a spark. Lots of people were actually wondering what I was talking about. I didn't know. By the time I had gotten nowhere, I just went back to the UK, disheartened, thinking, well, it's not the time. And but it had actually set a spark going. And by 2011, people had already, so it was in people's awareness. And there was a geriatric center set up in Ibadan. I became one of the visiting lecturers for that center, visiting doctors for that center. And yes, so there is now a knowledge of geriatric medicine. There is now that concept. People are talking about it. And whether we like it or not, everybody knows the main people that access healthcare anywhere in the world are the aging population. The aging population are the ones that need healthcare the most. Children do, but when you look at the demographic of the people who are really sick, and when they're sick, they are sick, and lots of the times it's things that can be managed, but that nobody really knows how to manage. That's why you need geriatricians. It is proven. Once you get geriatricians involved in the care, the healthcare of elderly people, they do better. They do better. It costs the families less because, people are not just experimenting, poking around and asking for lots of money. We have a targeted approach. So it costs the families less financially, physically, mentally, and psychologically to have a geriatrician involved in their parents' care. Now that has been proven as well. So yeah, so now, there's a big awareness when it comes to geriatric medicine. At least it's getting better. The government is aware that, so now I just believe now that, you'd have to have been not listening to any kind of news or watching any programs to not know anything or have never heard anything about geriatric care. And yeah, so things are improving very, very slowly. We've got, to my knowledge, at least they say 7 to 9, but I think probably, I don't know, very, very few geriatricians in Nigeria, very few. And I'm one of the very few, probably can count the numbers on one hand. And yes, so we need a lot more awareness and a lot more geriatricians in Nigeria to be able to help, because the aging population is aging and the percentage of the aging is getting bigger, much bigger.
Thank you very much, because one of my big questions today was going to be the current state of geriatric care in Nigeria, which you have answered a huge chunk of that, talking about the awareness. I can say maybe it is in the pupa stage. I can't say it's in the larva stage yet, but that's on the side of the stakeholders, the specialists, the people in the medical field, the government as well. But now let's talk about the individuals themselves. In your years of experience, especially in Nigeria, what would you consider the disposition and the attitude of Nigerians themselves towards seeking specialized geriatric care?
So, like I said, when I first came in 2007 with this concept of geriatric health care, with my plans to set up this geriatric service, I had, I hit a brick wall. In fact, people, nobody seemed to be, there were, I must say though that, yeah, I have to be fair, really. There were some people who had issues with their parents and with elderly loved ones, and they were very keen, very interested. I think it's only when you get to that stage that you realize the gap that there is in that healthcare and in our healthcare setting in Nigeria. But I have since found 10 years later, when I now came back, or 11 years later, when I came back in 2018, I actually came back and said, here I am with JBS Medicare Services and Elderly Healthcare Service. I hit the ground running. It was as if people were like, wow, thank God. And, lots of people actually, when they call in or they call to book assessments for their parents or loved ones, they say things like, we've been looking we didn't even know there were geriatricians in Nigeria. Someone actually said to me, I knew there must be a specialist. I knew there must be someone who does this. He Googled and found the term geriatrician and then looked for and found me. So, people know, you get to that point, because when your child is sick, you take them to a pediatrician, right? So people know that there are specialists that look after children. So people are starting to get more aware. The predisposition towards geriatric healthcare is huge. It is huge. People are looking for geriatricians. From what I have seen, this is just my experience. People are looking for, and people are happy to have access to that sort of service. That is what I have found. And it's been really, really good to know that, and really good to experience that. Yeah.
Thank you very much. Now that will lead me to the other part of the question where I was going. So since we're trying to get more awareness, knowledge about geriatric care and everything that involves in gerontology. Now, how would you explain to someone if there is any difference at all between old people's homes and a gerontology center?
Right. Okay. So it's basically, like I said before, geriatric care comes in two arms. There is the health care, so this geriatric person is sick. They've got something that is peculiar, might be dementia, delirium, falling over, something, something that is part of the syndromes of geriatric medicine. They need to have their health care sorted, they'll come to the gerontology center. Okay, because the gerontology center, so there we have clinics, we have dementia days services where you can bring your elderly person with dementia for the day to have specialist care, day care. We have inpatient facilities, so we can actually admit the elderly person into an area where all we do, because we're so geared towards geriatric care, that our aim is to get them in and out quickly without adverse events. So that's the difference. Elderly people's homes or old people's homes are just a residential home. They're a place where you have an elderly person who can't look after themselves at home. They're now dependent on carers, on nurses, and maybe they're not safe at home for whatever reason. They just need somewhere to live where there is care provided. They go to an old people's home. There is no medical input there at all. If they are sick in the old people's home, they either have to come out to a hospital or have a doctor come in to look after them there. So that's the difference. The gerontology center that we have is actually a hospital. I call it a one-stop shop hospital because we provide inpatient care. We have our clinics. There's a day activities unit. We do things like supplies. So anything that an elderly person needs, they need a wheelchair, they need a commode. You're not even sure what they need. You can just phone in and say, look, this is the problem we have. What do we need? And then we can sort that out for you, And what else do we provide? Therapy, physiotherapy, occupational therapy, nutritionist. So all of that is in-house. But you can't say, I need a place for my old person to live. We won't be able to take, we try very hard to have what we call a quick turnaround. So they're sick, they come in, we address that sickness, we address that illness, we get them well and home. They can come in for what we call respite. So someone is going away for like a week or so, and the elderly person is someone who is not particularly well. They've been managing them at home, but they just want the person to be in a safe place for maximum of a week or so. Have nursing care, we can do that, but we wouldn't do anything long term. You can't just bring your elderly person and say, we want him to live here. So that's the difference.
All right. Thank you very much for that clarity. So that somebody knows there is a difference between a gerontology center and old people's home. And you don't take someone to the old people's home and think you're giving them all that they need. They actually need the healthcare. And as you mentioned earlier, when you were establishing the basic knowledge about geriatric care. So it's like two arms. You've got the medical and you've got the social arm. So the old people home is more like the social aspect, right?
Yes.
Thank you. All right, so we'll go on a short break, and when we come back, we'll be wrapping this up by you telling us what you think if today there is a conference and they sit all the stakeholders down and they say, we are now ready. And by they, I mean the government and every other person who is involved in moving this practice forward. And they say, we are now ready to do something concrete about this. What are the things that should be on the table when it concerns getting geriatric care rights in Nigeria? That's what we'll come back to after this break. But if you have been listening and you have any form of question whatsoever, or there is something you'd like to clarify, the WhatsApp line is open. WhatsApp line is 0809-444-0981. Again, 0809-444-0981. My guest has been Dr. Olutoyin Akande-Ajala, and she is a consultant geriatrician. We'll be right back.
My name is IBK Spaceship Force. I inspire my world.
All right, so we've got about, thank you. We've got about, let's say 4 minutes after the break.
All right. Yes.
Just wrap that up and talk about what we need to do. As much as the knowledge, the awareness has increased, but there needs to be concrete things, because like you mentioned, you need to take breaks from.
Yes, yeah.
I imagine how many people you have. I think What health organization says you have a doctor to how many thousands of patients in Nigeria?
In Nigeria, so talk about geriatricians, so at this time they're saying that we have probably between maybe 5 to 10 million. That's what they're saying. I believe we have much more than we have much more than that. So you can imagine having five geriatricians who are looking after all of them, and we better face this thing, because in about 30 years' time we're going to have an explosion.
Yeah.
I'm going to be 83 in 30 years' time. 5 geriatricians won't cut it, because this generation is aging better, much better, and living longer. So we have to do something, really.
9
a.m. Us. Even on the selfish note.
I mean, it's only fair that what you've done for others.
Yeah.
But then you should have people around who can stand in the gap and do much more. We're supposed to be advancing, right? One shouldn't have to age with fear. But it's crazy. All right, we're back. Love music and love life. We are Smooth 98.1, 27 minutes past 8 o'clock, and we are talking about geriatric care in Nigeria. If you have not had so much knowledge about what it is before, now you know. And if you're just tuning in, you have missed out 27 minutes of good conversation and enlightenment. But don't worry, we have the video saved for you on YouTube. YouTube channel is at Smooth 91 FM Lagos. Again, at Smooth 91 FM Lagos. You should stay subscribed and click on that notification bell so that whenever we go live, it's to share something vital and important. You can always tune in and then be a part of the discussion. We have been talking, like I mentioned again, about geriatric care and getting it right in Nigeria. And my guest is a consultant geriatrician who has extensive knowledge in this, from the knowledge of, the specialty. Now, this is me from dementia, managing dementia, Parkinson's disease, pressure ulcers, stroke, incontinence, mobility issues, heart disease, falls, and diabetes. She has extensive knowledge in this aspect. And she is also the chief executive officer and founder of JBS Medicare Services. Now, before the break, I did mention that when we come back, we'll talk about how we can take active steps, concrete steps in Nigeria to get the care right. Because as much as the knowledge and the awareness is increasing, there need to be steps or actions that need to be taken. Maybe by incorporating it, as much as there has been the modification and postgraduate study, maybe it needs to even come to medical school, from year 1 or year 2. I don't know when you start to incorporate those courses in medical school in Nigeria.
Well, you see, the thing is, so for specialist training, it has to be after medical school. But what happens in medical school is that you're actually exposed to these departments. So when you're in medical school, you're exposed to, cardiology, nephrology, chest medicine. You have to have a department of geriatric medicine to be exposed to geriatric medicine. You have to have consultant geriatricians, in-house, who can actually start to, sensitize and train medical students, introduce them to these topics. That's what we don't have at the moment. That's what needs to happen. It takes a lot because, it's not just for medical school training. There's so many colleges that need to approve the formation of departments. So, I can't just go to a medical school now and say, oh, hello, I want to set up a department of geriatric medicine. There are so many hurdles that need to be crossed. So the West African College of Physicians would have to approve it. The government would have to approve it. There are so many bodies that need to approve setting up departments of geriatric medicine. You've got to actually have the teachers, you've got to have the geriatricians who can come in to be the lecturers, the consultants, not just, all this willy-nilly somebody waking up and saying, no, here I am, I'm a geriatrician today, just because I looked after this old person last year. So things have to be formalized and structured. You've got to get, the stakeholders really have to be, they just need determination. I'm not sure how that is going to work at this point, but we'll see. With everything, you start from somewhere. So we do have stakeholders now. I mean, there's a national senior citizen center in Abuja, which it's not run by doctors, but at least it's a body that is trying to move things forward for senior citizens. So if we can have more and more, and what we need is relationships with the ministries of health, with the colleges of physicians. It's going to be a big ask, but it can be done. It can be done. So hopefully people listening will be able to petition the people they know in government to get involved, to be interested in moving this forward.
Thank you for the latter part, because I was going to ask what will be the roles of the individuals. But
the individuals just have to petition the people they know. I mean, people in government know people. So it's all about education and petitioning. We've got to put it out. So, those of us who are, in a way, I'm a geriatrician, I'm a stakeholder as well. Because, like I said earlier, I'm going to be 83 in 30 years' time. And I would love to grow old in Nigeria and be looked after in Nigeria. That is so we would need a lot of geriatricians in 30 years' time, because the population is aging better and living longer. The life expectancy is getting much, much better. So in 30 years' time, we're going to need to have a lot of geriatricians, trained ones, to be able to look after the huge number of old people that are going to be around with the geriatric syndromes that we have. So here's fingers crossed and hoping that all the work we're doing will make a difference. The work we've started to do now will make a difference by then,
Hopefully.
Yeah.
And I'm also having the interesting thought that a number of Nigerians who have migrated out of the country, maybe just my thought, they would want to come back to the country. So maybe they will also need to invest in the healthcare, especially if they want to come back and have a good life. So maybe they can be angel investors, or they can be venture capitalists. You just find people who you are like-minded with, and you put some money, and you have the centers, come up from the ground. Just maybe.
Yes. Yeah. Yes.
Okay.
I agree.
All right.
Working on it.
Yeah. Thank you so much for your time this morning. I had an enlightening time. And for people to catch up with you and your travels and every other thing you do on social media, how can they do that?
So social media, I've got my so in Instagram, I've got my handles Dr. Ajala _Ajala Travels and JBS Gerontology Center. So we've got 2 handles on Instagram. I'm also on Facebook as Toyin Akande-Ajala, and on LinkedIn as well as Toyin Akande-Ajala. And we've got JBS Gerontology Center on all handles as JBS Gerontology Center. So yes, you can contact us that way.
Thank you. Thank you very much. I hope that you have a good weekend, not too filled with patient and consultation and assessment.
I'll try.
Thank you so much, and enjoy the rest of your morning.
Thank you. All right. Bye-bye.
Bye. All right, Lagos, Nigeria world, thank you for being a part of the show. And we do hope that you've been able to take at least something from it. You know better what geriatric care involves, and you know what to do if you're looking to have geriatric care improved in Nigeria. Like my guest mentioned, you can petition the people who are making those policies, or people who can do something. And if you have some money lying around, you know how we say it in Nigeria, that if you have money you are not using, you can invest it in the healthcare sector, because at the end of the day, you will grow older and you don't want people to do guesswork on your health. So if you're going to get older, there is specialized services for the elderly ones, and it is geriatric care. So you can invest in it as well. Thank you again. And you know that it is a Saturday. 8:40 is the time for the children to get started on Curious Minds. It means the Winners from the month of September will be in the studio with me. And as always, it will be a great time. Join us at that time. But in the meantime, you will enjoy something from Michaela Malaka with Step Aside with All the Bad Energy and the Unruly Attitude, which is an admonition to the children out there. You're listening to Smooth 98.1.
And the rest will follow. So, what does health look like for me?
Thank you for streaming live.